Okay, great. All right, so welcome to Integrating Healthcare into Youth Transition Processes. What do we know and how can we help? Again, please sign in by writing your name and organization in the chat box. And very excited, we have a great crowd today. Thank you for joining us. So for just a few things to think about during the call today, please, mute your line. We will take questions during and at the end of the presentations. If you have any questions, you can feel free to put those in the chat box. You can also use the Zoom features, raise your hand, or just unmute yourself and speak. So our agenda today, So Ann Harris is going to provide an introduction to the Wisconsin Integrated Transition Planning Project, or WITP. I will be sharing the top assets and the process we followed to come up with that list. We have two guests joining us in a few minutes, and both are members of that WITP coalition. They will share their story of integrating healthcare into transition processes. And then Tim is going to wrap up with a state and a national example of movement toward integrating healthcare into transition. All right, I'm going to hand this over to Ann.
Thank you, Beth. So again, my name is Ann Harris. I am the project lead for the Wisconsin Integrated Transition Planning Project. There's lots of acronyms. We've been calling this WITP. And I'm at the Waisman Center. My main title is the Wisconsin Lend Director, but that's a training program. I'm not going to talk about that today, but I did at the last Youth Health Transition Initiative Learning Community. So if you want more information about that, you can look at our website. We are a part of the Waisman Center at the UW-Madison campus, and in particular, we're part of the University Center for Excellence in Developmental Disabilities, which had the opportunity to apply for a planning grant for 1 year, which was September of 2020 through August of 21. So we just finished our 1-year planning grant, and we called it the Wisconsin Integrated Transition Planning Project. So next slide, is a reminder for me to define, if possible, what we're talking about when we're talking about integrated transition planning. So we're talking about the process of moving from being a child and youth to adult life for people with intellectual and other developmental disabilities, including also special healthcare needs. And we're talking about planning for that transition process by looking at options for employment, further education, post-secondary education, and what they need to do to move from pediatric to adult healthcare. And we're talking about doing that planning in an integrated way or a coordinated way where the people who are helping develop planning processes through healthcare or through education or through employment agencies are all thinking about the training and education and support someone would need. What is their future career going to look like? With the goal of both employment that is competitive and well paid, as well as activities that will integrate them in with their communities. And then how does their healthcare transition planning support that process? So to be able to work and live and enjoy their environment, we want people to be as healthy as possible. And so that process needs to be considered as part of this transition. So that's as much as I'm going to say about integrated transition, and we can move to the next slide. This planning grant had a project goal of, and this was defined in the grant opportunity, to develop a transition pilot plan for Wisconsin youth. And we included adults as well, with IDD or intellectual and developmental disabilities in medically underserved Wisconsin communities. And we had the ability in our grant application to define what components, I'll say, of integrated transition planning we were going to include. So we included the three, which you'll hear us repeat several times: healthcare, education, and vocational or employment services. So those were the three things that we're trying to integrate in this project. I'll come back to a couple of other things, but first to let you know who was involved. And the next slide shows our leadership team. We don't have to spend much time on there, but I was the lead. And we had Leanne DeWalt, who's our UCED, or University Center for Excellence in Developmental Disabilities Director. And as a co-PI, we had people from the Board for People with Developmental Disabilities, Jenny Newgart, who's also on our UCED Constituent Advisory Committee. Beth Moss was the project coordinator. Shannon Webb was our contracted facilitator for our coalition meetings. And our evaluator, Lynn Robick, is the same as our, she's also on our Youth Health Transition Initiative team as the evaluator. So a lot of people with experience in transition planning, and the coalition, which is on the next slide, consisted of more than 20 partner organizations that signed our original memorandum of agreement to participate in this pilot year of planning. And we included employment groups, education groups, family and advocate groups. We have school districts. We had state partners at the Department of Public Instruction, or DPI, at Department of Health Services, or DHS, and in the Department of Vocational Rehab, or DVR, representing our three areas that we were did work on for integrated transition planning. Our project timeline, which is the next slide, was shared and developed with our Wisconsin Transition Planning Coalition. So another abbreviation, we called it the coalition, the WTPC, or Wisconsin Transition Planning Coalition. It met monthly, and the goal again was to develop a pilot plan for Wisconsin. And there were several requirements. We did need to complete an asset inventory, or a list of our comprehensive review and analysis of the resources already available in Wisconsin. This project is not intended to create new things unless they're needed. But first we had to start with what exists and who's doing this well. We used a community of solutions approach to creating the plan, which is to engage with communities. And again, this is focused on medically underserved. So not the communities that have a lot of services, but those for whom transition planning is either lacking or inadequate. And trying to create a plan for how we could engage with those communities to address some of the needs. So the next slide talks about some of the methods we used. And we tried to take a very positive approach and look at strengths and using people's experiences, their stories, what we call bright spots where things were working well. I mentioned creating the comprehensive list of assets. There was a lot of stakeholder engagement. So again, our goal was for our coalition and for our community groups to have a large, if not half of their members being either family members or individuals with disabilities themselves. And we used this community of solutions framework, which is evidence-based, to have communities engage in some activities, starting with an equity action lab. We're not going to go into a great deal of detail about that process, but you'll see some of the results of that process. So the next slide is how we started collecting assets, and we had quite a few meetings of our stakeholder groups. These are smaller groups of our coalition members, came up with over 300 ideas, some of which you'll hear about from Beth, and she'll describe the process in more detail. We're still editing and refining the criteria for what is going to meet our need for integrated transition planning. But today we're going to focus on those assets that included healthcare as part of that transition planning process. So the next slide talked about a little bit more about that person-centered approach that we used versus a deficit approach. So you'll see that what we were trying to find out from the communities that we engaged with was what is working. And while many of our systems sound good, many people's experiences are not optimal. So we do have communities who are addressing the issues around collaborating and person-centered thinking, and the community of solutions approach was helping us find where that was working well. And that would then inform the development of our pilot plan. So we talked to representatives. We did a recruitment process for communities in Wisconsin. We talked to over 10 communities or members in different communities around Wisconsin. And the next slide shows that we ended up identifying 3 communities who were ready to engage in the work, because we had a pretty short timeline and we had to get this planning project finished in a year. So we worked with people in Rock County, coordinated by UW-Whitewater. We worked with some people in northern Wisconsin, in the Rhinelander area, with the Headwaters Agency and the Rhinelander School District. And we worked in Barron County with Inclusa and other community members, and that's in western Wisconsin. So we looked at these 3 areas, really mostly rural, although the Rock County group was sort of a combination of urban and rural, medically underserved communities. So the last slide, my last slide, is relatively complicated. So I'll just point out a few things. This is what we end up with as our integrated transition approach or plan at the end of the planning grant. And we use this to apply for additional fundings to implement the plan, but we haven't heard yet whether we've got that funding. So this driver diagram, which is a public health way of organizing our information, reflects the combined findings from the stakeholder meetings, the equity action labs, and subsequent work in those 3 communities. And then our coalition as a whole reviewed it prior to our submitting our continuation request for funding. So the main goal is that families and youth receive relevant information and support for integrated transition planning by the time the youth with IDD turns 18. And I'd like to focus on the middle column, which are the primary drivers. And these are the activities or they're actually not activities. These are the strategies that are really necessary as identified by our communities to achieve that goal. So the first one is systems work together to provide integrated transition planning at a local level. Second is transition information is readily available and accessible through different resources and diverse stakeholders. So it's not just one way that the family and youth would need to get the information to be successful, and that youth and families have support to navigate the system. The fourth strategy is healthcare is accessible and included in transition planning. And I want to point out that this one highlighted the need for healthcare to be both available and involved in the transition planning process. And that was identified by our communities as often the missing piece, and why we decided to have today's learning community focus on how healthcare can be better integrated in the other systems that are already doing transition planning, so that everybody is aware of what is needed to do that transition from pediatric to adult care, and that's integrated with their school and vocational planning. So that was my final point. I wanted to say that and turn it back to Beth to start to talk about, take us back a little bit to maybe the assets that we're going to share with you. And then later people will describe the examples of how we actually did, what successful examples of who was able to integrate some more healthcare information into their current activities.
Right. Okay, thank you, Anne. Yeah, so I will spend a few minutes talking about the asset inventory. Why did we do this? Well, first of all, it was one of the required deliverables for the grant. The comprehensive review and analysis was the actual required product, and the asset inventory is part of that, CRA, and Anne referenced that as well. We also felt it was really important to get a baseline and determine the strengths and the gaps of resources that were available already in Wisconsin, before we started talking about, integrating these resources and assets, so that for transition. And in addition, we felt that this would be a great way to start out our coalition. Collecting resources as a group was a way to engage those coalition members and find out what was happening in their area of the state and also in their area of expertise. So we did collect, a large quantity of resources. We said there were no wrong answers. It was, everyone kind of contributed. And then we took those, put those all together and came up with a list of assets. And so what is an asset? An asset is a resource that helps to achieve a positive effect. We then kind of tried to organize those assets. We came up with 9 different types of asset or resource, and we wanted to include a wide scope, all the way from national resources through state, county, local, all the way to organization specific. An example of a type would be like an MOU or a policy, or training and guidance for families or professionals, or an internet resource. And there were 9 of those. Once the inventory is complete, also knowing where, geographically the resource can be accessed is going to make it a whole lot easier, the product more accessible and easier for people to use. The resources we collected all fit within one or more of the 3 areas: health, education, and employment. Many of those overlapped, meaning they were applicable to more than one area. An asset that applied to all 3 of those areas is defined as an integrated asset. And our primary focus is to integrate health into transition. So we focused on making sure that healthcare and health transition are included in those resources that we're listing as our top ones and integrated. So it's just really important to remember that an asset is a resource that helps to achieve a positive effect. It must be something that is not a one-off event. And we also wanted to take into consideration the scope, the type, and the geographic area. So criteria for a top asset. It must be enduring and it must be integrated, meaning it must also include health. 3 levels of resources to consider that we kind of came up with: the broad resources that lead to other resources or information and referrals, the how-to resources, such as a policy, a procedure, or guides, for families or for professionals. And then the third one was stories or real-life examples that illustrate integrated transition. So that first level is the broad resources. The first one is the interagency agreement among the Department of Health Services, the Department of Workforce Development, Division of Vocational Rehabilitation, and the Department of Public Instruction. And Tim is going to talk about that one a little bit later in the presentation. The second one for a broad resource is actually a national one. The Pacer Learning Center is out of Minnesota. They have a wonderful website. They encompass major components of transition to adulthood, a lot of great resources for youth and families. And they do have modular content. They address education, employment, and health. And in Wisconsin, we have our 5 regional centers. They are staffed by information and referral specialists. They are available to assist with any questions about transition planning, including health benefits, which is kind of their specialty, but they also include independent living, employment services, and communication with schools. So you can see the pattern that all of these are encompass all 3 of those areas. And the last one on this slide is the Aging and Disability Resource Centers, or ADRCs. This one, youth do not access this until they're nearly 18 years old. So it doesn't really cover that entire transition period. However, it is an extremely important resource because they're the gatekeepers for the long-term care benefits. So just prior to the youth's 18th birthday, they will apply to do a functional screen. That functional screen will determine the level of service that they'll receive. And those benefits are everything from in-home personal care and nursing, home modifications, adaptive equipment, Medicare, Medicaid, which does include the employment and independent living supports, Social Security, and others. The other kind of thing about the ADRCs in Wisconsin is that they are very different by county. Some of them have a large staff and have a pretty big, a big charge, and others are very small depending on the county. Some only have 1 or 2 people on their staff. So the next one, the how-to resources, the policy, procedure, or guides. The Family Voices of Wisconsin, What's After High School, really rose to the top. It's a training for families with transition age youth, gets great reviews from families and professionals alike. It's available online in English and in Spanish, and it addresses education, independent living, and healthcare. The Wisconsin Board for People with Developmental Disabilities toolkits, they have supported decision-making, guardianship alternatives, take charge of your healthcare, living well, and COVID-19. Sorry, I have a new remote speaker, and I'm hoping that you're not hearing the feedback here. Are you? Okay. I hope you can still hear me okay without the speaker. Okay. All right. The next one is the Finding Your Way, a navigation guide for Wisconsin families who have children and youth with special health care needs and disabilities. This one is a product of the University Center for Excellence in Developmental Disabilities at the Weisman Center, and it's available in Spanish and English. And then the another transition resource guide before age 18 or before age 18 is a website and guide that came out of the Wisconsin Promise Project. And it is also available in English, Spanish, and Hmong. And then the Transition Action Guide for Post-School Planning. This one was actually created in 2015, but there are plans to update it. And by 2022, we hope to have a new online training that will include healthcare as part of the healthcare transition planning as part of that process, transition planning process. All right. And then the third kind of level of asset are those stories, those real life examples, which we're about to hear another one. This one is from the Department of Public Instruction, Wisconsin Transition Improvement Grant, or TIG. And they do have on their website an approved sample post-secondary transition plan, or PTP, that includes an actual goal to manage healthcare. It talks about managing symptoms and medication for diabetes. So it's really there and ready to be accessed. All right, so why do we think that integrating healthcare into transition hasn't really happened that much? Well, we did find fewer examples than when we were looking at, say, education and employment being integrated. There have been so many well-funded efforts in Wisconsin to integrate employment and education, from the Medicaid Infrastructure Grant, Let's Get to Work, Wisconsin Promise. So there has been a lot of effort done to make sure that youth in Wisconsin are able to get the supports to work post-transition. Also, much of Wisconsin is considered to be medically underserved. So there are a lot of families who struggle to get healthcare. And so, trying to manage that as part of the full transition process is a challenge. And then also, most medical professionals do operate separately from schools. They're kind of in their own silo, and that's just been the tradition, and outside of the employment and independent living support system. So excuse me just a second. So we were thinking today we wanted to talk about how can we help. The first thing that we would really like is for everyone, families, teachers, medical practitioners, children's long-term support case managers, IRIS consultants, which is I respect, I self-direct, counselors, etc. Start thinking integrated. So try to start thinking about the whole person, and that will include their health and their health care. Right, IEP, PTP goals, individual education plan, post-secondary transition plan goals around healthcare management. We'd like for you to think about the lessons that we learned from our WITP communities, the Wisconsin Integrated Transition Planning Project. The families who participated in the communities were very vocal about the fact that they felt that they so far had not been able to receive information that was accessible, understandable, individualized, and encompassed the whole person, that it was coming from many different places and was very separate. So our three communities, Rhinelander decided that the way that they would address this issue is to provide a personalized guide for each student. So the first part of the guide is talks about transition, the integrated transition, and then the back part of the guide is about that individual student and is developed along with staff and the family and the student. In Barron, they decided to put together a set of one-pagers, and healthcare transition is on equal footing with employment and with education. And at Rock County, their idea was to hire a peer navigator who could provide individualized guidance for the family and for the youth for that period of time during transition to kind of get everything in order for them and to share that information in more of a meeting, kind of a face-to-face type meeting. We also would love for everyone to share our top integrated resources with schools, medical providers, job developers, and other service providers. We will be sending that out to you as the draft after the learning community. So right now we are going to move to stories where healthcare is included in the transition process. The first is a partnership that arose from the WITP Coalition. And second, I'm going to just let Tim move into his part. He was going to talk about a statewide initiative and a national movement. So first, we are very pleased to have Stephanie O'Connor-Shute. She's the director of the School to Work program at Milwaukee Public Schools. And Michelle Rosner is a parent of a young woman who has complex medical conditions. And I'm going to let them go ahead and tell their story.
Thanks so much, Beth.
Are you going to stop sharing the slides?
It doesn't make any difference to
Yeah, go ahead, Stephanie.
Oh, okay. So I'm Stephanie O'Connor-Scott. I run the School to Work transition programs for Milwaukee Public Schools. It's a group of programs that serves over 500 high school students with disabilities every year by offering opportunities for exposure and experience in vocational skills. We offer a continuum of vocational opportunities. We have a community assessment training program where special ed students from the 27 different high schools in the district go to work sites, partnerships with a lot of different types of businesses, Alverno College, Sinai Hospital, Hilton Outpost, just to give you an idea. And then some internal district ones as well. It's a class that counts towards state required career and technical education credit, and it's simultaneously a special education service that's provided by special ed teachers. We also have an on-the-job experience and on-the-job training, which is sort of the next level, but students not quite ready for competitive employment. One of those is paid, one is not, but again, the students get credit. And then we also have a Project Search site that is exclusive to MPS students at the Mitchell International Airport, and an employment training program that's for our 18 to 21-year-olds that's driven by the goal of assisting students in obtaining and maintaining competitive employment in fields aligned to their strengths and interests. So that's a little bit about our program and what I do. And over the course of this last year, I've had the opportunity to be part of the coalition. Michelle is going to share her story, and I think you'll see why I was so moved by her willingness to share her journey that she'd experienced with her daughter's health needs at one of the coalition meetings. I found myself thinking my staff need to see and to hear these stories firsthand so that we can improve our program's ability to support the healthcare needs of students. The staff in my programs are special education teachers, much like myself, that's my professional background, paraprofessionals and social worker. And we have specific roles in vocational transition support. So by nature of the program's focus and their training as teachers, their area of expertise with transition is on the education side, followed by employment, but really with less knowledge in the healthcare side. So Michelle's presentation spurred the development of a training for them to specific to healthcare aspects of transition. So as I began to develop the content, I kept thinking about Michelle's presentation. It was kind of that catalyst that got this whole training together. And I thought, wow, it would be really cool if my staff could hear from her directly. So I reached out to Beth and asked for permission to use the portion of the Health Coalition meeting that had included Michelle's presentation, which then ended up leading to her reaching out to Michelle and then ultimately being able to connect the two of us. And she agreed to conduct a recording of her story that was specific for my staff. So then it came time to actually doing this training with them. It started with a game just to kind of get them looking at what they already knew about fundamental healthcare and transition concepts. Ultimately, it proved that there were quite a few staff whose healthcare knowledge for students with disabilities was minimal. And we discussed emerging issues in access and equity to healthcare services for all people, in particular those with disabilities and also those who, in addition, are minorities, English language learners, socioeconomic disadvantaged, and more, which is a big portion of our population in Milwaukee Public Schools. I prefaced with who Michelle was and where I'd first heard, and then shared the recording that she had prepared for them. Not surprisingly, they were all so touched and really appreciated hearing the direct story from this mother and making that human connection. Several of them also acknowledged this really is an area that we have to expand understanding and resources. So kind of going forward, some things that I would like to be able to do is just more training for teachers, not only in our program, but teachers, special education teachers in the schools, to inform and ensure quality PTPs, especially in that healthcare side of things. As Beth said, the TIG has now an example out there, but we need to do more with that. So my teachers have now been using the transition healthcare checklist and sharing with families, and the full version was shared with them, and they have both the paper and the electronic form. So we're getting a little bit further along, but we have a long ways to go. I'm just so grateful that I met Michelle through this and for the Weisman Center's willingness to connect us and ultimately create a presentation that was just extremely meaningful and connected for my staff.
All right, thank you so much, Stephanie. I think that what you just said is absolutely exactly what we were hoping would happen. So thank you.
Oh, good. I wasn't sure.
Oh yeah, that was perfect.
Okay, well, so, it's just the truth.
That's great. So I know Stephanie has to jump off. She has about maybe 5 minutes. Michelle, did you want to say, have anything to add? Does anyone have questions for Stephanie before she leaves us?
The only thing I wanted to add is I'm really excited to see how the loop closed. I knew I had done the recording and I wasn't quite sure exactly how Stephanie planned to use it. So I'm really excited to know that it was successful and that it was meaningful for your team. And so thanks for sharing that part. It was a really gratifying project for me to work on too. My girl is very, very medically complex. And so through the transition, the healthcare piece has been the most time consuming and probably anxiety provoking for us. And so I think it's great that an educational team sees that for some families, we're not looking for Julia to live independently. We know that she's not going to have employment. And so to recognize that her educational journey from age 18 to 21 is very different than most kids, but it's still part of her journey and it's still an important piece of her transition that we need to pay attention to. And the healthcare component has such a big impact on that. So making that connection and sharing that with your team throughout MPS has been a really, like, I'm excited to have been a little part of that.
I'm grateful that that for you, just your willingness to share the story at the coalition, because that I would not have even thought about it, in all honesty. It's been humbling for me to even kind of sit back and say, this is an area that I too, even as the leader of this program, need to increase my knowledge in this. And so thank you for that.
My pleasure.
All right. Thank you. So I didn't see any questions in the chat. Stephanie, thank you again so much for joining us and for being a part of the coalition. It was wonderful to have a representative who has such a, I don't know, you affect so many teachers and so much staff at MPS. It was just really wonderful having you in our coalition. So thank you.
Thank you. It's great to be a part of it.
All right, great. Okay, so I think it's time we can move on to Tim. Take it away, Tim.
All right, thanks, Beth. Good to see everybody again. So my name's Tim Markle. I serve with the Youth Health Transition Initiative in a variety of ways, including some curriculum development. I'm also the director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. And I want to talk about a couple of initiatives that have garnered movements forward that are garnered in the state of Wisconsin, and also a little bit about what's happening nationally. So the state of Wisconsin has an intra-agency agreement between the Division of Vocational Rehab, Division of Vocational Rehabilitation, or the Division of Workforce Development, so DWD, DVR, along with Department of Public Instruction, DPI, along with the Department of Health Services, DHS. So all the acronyms coming together, and their goal in the interagency agreement is to support successful transition from childhood to adulthood for Wisconsin residents with disabilities. The outcome that they're looking for is competitive, integrated employment. So years ago, over 12 years ago, when I started work in this area, there was an interagency agreement. There was also some legislation that was passed in 2017. And throughout, at the beginning and in the iteration, the part of DHS was mostly played by Children's Long-Term Support and the waiver system. And in our opinion, this was an area that maybe could have been bolstered a little bit, as it is through DHS that we have the Children and Youth with Special Healthcare Needs program. And so we've been working with DHS, and last year they were working on revising the interagency agreement, and DHS reached out, and we were able to include in the new agreement is they put in language that I find fantastically, I'm really excited about. Okay, I'll put it that way, in case you can't tell. Number one, in one of their graphics about who could be involved in transition, who should be involved in transition, the Children and Youth with Special Healthcare Needs program is in there now. along with the Youth Health Transition Initiative. So a recognition that health is an integral and key part of the transition experience for our students. And then they call it out further on one of their pages when they say youth with medical conditions that require management need health transition goals included in their IEPs to prepare them to be responsible for their own health condition in the workplace and independent living. This includes the ability to share information about the condition, seek appropriate care when needed, and instruct others on how to assist in a medical emergency. So one of the ways that I like to view this interagency agreement is that with the Youth Health Transition Initiative and a number of partners throughout the state, which one of our key partners is Wisconsin Transition Integration Grant, the folks at WITPP, just, fantastic folks that have been on board and helping get the word out about health transition as well. But I see parents and our students are down here, and we know the need for this to be included in IEPs, to have a holistic view of how transition, that our health affects our employment, our health affects our higher education opportunities, our health affects where we live, our health affects our quality of life, that all these things matter and they're all contained in that same one person. And then up here, we have these policies, and sometimes the policies support what's important to the family, and sometimes the policies seem to be disconnected from what's important to the families. What I see in this interagency agreement is the coming together of the policy and the family and saying that, look, our kiddos need to be healthy and this transition needs to happen in healthcare, and they need to understand if we want them to be the best self-advocates that they can be and the agents for their own life. And now the policy says, hey, DVR, DPI, you need to include healthcare in there as well. And so I'm really looking forward to seeing this agreement operationalized, big fancy word. I can't wait to see how it is now in the transition action guide, how it's going to be put into action and how it's actually going to be implemented in Wisconsin. So I'm hopeful that it will will start to lead toward better integrated transitions for our kids. So at the same time, this is going on in Wisconsin, which is super exciting. There's also some movement going on in the 50 United States and a little bit beyond. A few years ago, I was able to attend a national meeting of the maternal child health people, and maternal child health is part of Title V, and some of you will know what that means, but basically overseeing funding from the federal government, okay? So we have funding provided by them through Title V, and then they give us some performance measures and goals that we are supposed to be working on. So I went to one of the national things because I was really, one of the breakouts I went to was from a person from Minnesota who was talking about how they were working on integrating some of their healthcare into their individualized education plans and how there were specifically instructions from their legislature to do this. And so I wanted to learn more. So I learned more, talked to the person afterwards. At the same time, I'm talking to the person afterwards, a member from the Family Voice of Wisconsin in Texas is also talking to them. And so the three of us decided, we need to talk together. And so we started to form our own little mini coalition. And then that mini coalition started to grow. And so now we're meeting monthly with not just Minnesota, and I apologize for, I don't know how I just got into the middle of a construction zone, if you can hear that. I'm not exactly sure what happened, but hopefully they're moving on. But the coalition has grown to not just Minnesota, Texas, and Wisconsin. We also have representation from Oregon, New Mexico, North Carolina. We've reached out to Florida. We have the District of Columbia. We have our national partners, Got Transition, have been joining us to the calls to help give us an idea about how to organize moving forward, because right now it's just grassroots. We're really concentrating on learning what is being effective in the various states that are working on and what is our scope going to be. But it's really exciting because we know that for all the states that choose a national performance measure of healthcare transition, that we want them to consider, what does healthcare transition look like in the IEP? What does it look like in post-secondary transition planning? How can improved healthcare support improved competitive integrated employment? And so with all those groups coming together, we are still meeting monthly. We're learning from each other. We're learning how to integrate. And this is going to go beyond just the education, but the focus of this group is healthcare and special education. So excited to see what this national group may come up with. Thanks, Beth.
All right. Thank you, Tim. Now we have a few minutes. Let's see, we've got about 5 minutes, and would like to really hear if anyone on the call has any integrated transition stories, or where you've seen healthcare included in the transition process. If you have personal stories, if you've heard of anybody who's doing a really great job with this. I think I'm going to stop sharing. We have our evaluation link in the chat. And so please complete that evaluation before you log off. And looks like we have, I will stop sharing so maybe we can see everybody. All right, do we have anybody who has a story that they would like to share? Anyone?
Maybe we could stop recording if that's a problem.
Oh,
as well.
yes, yes, definitely. I'll do that too.